is in compliance with the state or federal regulations. So we, for every healthcare facility in the state that is required to be licensed, we're the ones who issue the licenses, and we're the ones who, on a regular basis, typically annually, do inspections of these facilities to make sure that they are continuing to comply with the licensing requirements. Similarly, we do this on behalf of the federal government, and there are counterparts in every state, like the Office of Healthcare Assurance, who also conduct federal inspections on behalf of Medicare. And the federal requirements are just, enormous. And so we have a staff, mostly nurses, that conduct these inspections. For a skilled nursing facility, we will typically send as many as 4 inspectors, surveyors, for as long as 4 days, and even longer if we find issues, for one facility. So this is an extremely extensive survey and inspection. We look at everything from governance at the very top, and ensuring that the governing body is adequately monitoring the administration and services being provided by the facility, to the administration and management, as well as all the healthcare kinds of things, all the nursing care, all the admissions and care planning, discharge planning, infection control, medication management, any aspect that has to do with providing care to the facility and how that care is coordinated throughout the facility among the nurses, among the other licensed professionals like physical therapists and pharmacists and others, and including physicians, the attending physicians or the medical directors at these facilities. A component of what we do also includes life safety, where we have someone who is a subject matter expert on fire codes and fire safety and sprinkler systems and ingresses and egresses and pathways out of the egress area. So every aspect of the facility comes under some kind of a regulatory requirement, and we're the ones who go in there to conduct these inspections. I mentioned the Medicare certification. So we've got 42 skilled nursing facilities that are state licensed as well as Medicare certified. Medicare certification is voluntary. You don't have to be a Medicare certified facility. We do have a couple of skilled nursing facilities that are not Medicare certified, state licensed only. They have to at least be state licensed. We also have a portion of our staff that conducts state licensing only inspections. These are for the facilities that do not qualify for Medicare coverage and therefore don't fall under Medicare certification requirements. These are the residential care homes. There are approximately 1,700 of them statewide. Most of them are the community care foster family homes, which provide nursing level services to individuals in residential homes instead of those individuals being in a nursing facility like a skilled nursing facility or intermediate care facility. We have over 400 adult residential care homes as well. The adult residential care homes are typically for residents who are a bit more independent. They don't require the kind of nursing services that you typically see in an intermediate care facility or a skilled nursing facility, but these are also in people's homes. These are all licensed facilities. And then in addition, we have domiciliary homes for developmentally disabled. We have assisted living facilities. We have therapeutic living programs, special treatment programs, which are typically drug or addiction recovery programs. And then, on the larger institutional level, hospitals, skilled nursing facilities, clinical laboratories. We license the clinical laboratories as well under the CLIA program, and ambulatory surgery centers, dialysis facilities, home health agencies, home care agencies, any kind of facility that's required to be licensed in the state is our responsibility. We have a staff of approximately 22 surveyors that go out and conduct this work. And about a dozen of them are the ones that do the institutional facilities, like the skilled nursing facilities. Skilled nursing facilities, as I mentioned, as many as 4 nurses will go out for 4 days. Well, it doesn't take much to do the math to realize that, if you're spending about a week, because you got 1 day to prep for the survey, and then 4 days that you're on site doing the survey, and then you've got to, spend some time writing up this, your findings. It won't take long before, you do all those skilled nursing facilities in a year, and you haven't been able to touch any of the other facilities with the number of staff that we have. So our whole concern about House Bill 488 and Senate Bill 835 was in terms of a requirement that we could not be able to meet with our current resources. We estimate that we would have to at least double the number of surveyors we have, so that we would break a cycle of having to go from survey to survey to survey, and in between surveys to have the time to write these inspection reports. And so without those additional resources, there's no way that we'd be able to get to all the facilities and be able to post the kinds of inspection reports that are being asked of us to post on our website. So that was our problem with House Bill 488. We testified to that. And it certainly appears that what the bill would have required was a posting of the inspection results within 5 days of exiting the facility. And we don't even finish writing the inspection report in 5 days. An inspection report for a skilled nursing facility can be extensive. We gather all the evidence. Now we have to write the evidence, and we have to write it in a very clear and complete way, so that if it were to ever go to court, someone not familiar with the survey process or all the mechanics of conducting a survey would be able to read that and easily understand why a citation was issued to the facility. So we have what we call a based on statement. When we say, here's the regulation, facility, you failed to meet the regulation based on our observation, our interview of staff, and our review of records. The review of records could include medical records. It would also, and always does, include a review of policies and procedures that a facility has that guide them on how they're going to provide services within their facility. And I mentioned earlier on, the governing body and administration, we asked to look at minutes of board meetings and of management meetings to see, and of in-service education opportunities for staff. Infection control, for example. Is the board aware of the infection control problems that the facility has determined? Is the facility even determining if they have infection control problems? This was one of the key things that we cited Yukio Okutsu for recently, when they had those many deaths associated with COVID-19, is that we cited them for not having evidence to show to us that they did a sufficient, that they did any kind of quality assessment and performance improvement on infection control. So they got cited for that. So these are the kinds of things we look at. What evidence do we have that the governing body is aware, that they have passed down in terms of policy, how the facility should provide these services, and that the administration and management made sure that those things are actually being done. What infection control reports are being made to the board, what information is being passed down as far as what the staff are required to do. So this is an extremely extensive review that we do. It takes a tremendous amount of detail. It takes a tremendous amount of time and skill and knowledge for our surveyors to go in and ask the right questions, look at the right materials, observe the right kinds of things, and then to write up an inspection report. Typically, it'll take us at least 10 working days to write the inspection report after we leave the facility. Depending on the amount of evidence that we have to write on and the citations, it has often taken us more than that. It's taken us, for the Yukio Okutsu, for example, it took us about 45 days. We had to get it right. And we did, and they got Medicare, CMS agreed with our citations and issued a very hefty civil monetary penalty against them, which is being appealed, but that's a whole other thing. So this is the extensive nature that we go through, and the amount of time that these bills were requiring us to post the inspection reports after leaving the facility with the staff resources that we have just was not doable. So it would be very helpful to hear from the Kupuna Caucus in terms of what is it really that you are looking to try to achieve by either through these bills or through similar bills in the future, and how can we work together to try to make that happen? Our role is to protect the life, the health, safety, and welfare of the public. We take our job very, very seriously, and we want to provide as much information to the public as we possibly can. But as I mentioned, the requirements of this bill just were not something that we were able to do. So what is it that the Kupuna Caucus would like to achieve? And let's discuss that. And if you have any questions on what I just kind of went over in terms of your process, please feel free to ask about that as well.
Thank you, Keith. So are there any questions of Keith on procedures or what we're talking about in terms of the bill and its requirements? Please raise your hand or no, whatever the icon. Rick?
Well, Kathy had her hand up first. Go ahead, Kathy.
Oh, Kathy.
Okay, that's okay. I didn't hear you say what you think would be a reasonable time for you to be able to post the results of the surveys.
Yeah, that's my question too.
What is a reasonable time?
Yeah.
Given our current resources and the time it takes us to write inspections and go from inspection to inspection.
Well, I would shift the question just a tad bit and ask, what is the requirement right now for posting? I mean, there must be a timeline. Do you have a timeline that's reasonable? But what is the actual timeline that you have to post your findings?
So the background is that there is language in statute now that says that we post within 5 days of an inspection. Okay. We were not posting within 5 days because there was an interpretation that 5 days meant from when we exit the facility, which is what House Bill 488 and Senate Bill 835 tried to clarify, that it is upon exiting the facility. So we were taken to court and we explained to the judge that because the way the HRS is worded, it's within 5 days of completing the survey. Well, our argument was that the survey is not yet completed until the inspection report is done, until the facility corrects those citations that we've identified, and we've confirmed those corrections, or we've at least accepted their written plan of correction on how those deficiencies would be corrected. And so our discussion with the court was that that's the inspection. It includes all of that. It's not just when we're on site. And the judge agreed. He agreed with us that the inspection is still going on. And there are times, let me just also add, there are times when our staff leaves the facility, comes back to the office and has a discussion among the staff or with their supervisors on whether something rises to the level of being citable or not. Do we have the evidence for it? And we oftentimes will go back to the facility, or we'll ask the facility to provide us with additional information. So the inspection is not yet done just because we physically left the building.
What's in your, I'm sorry, go ahead.
And so that's what we're looking to do. We are looking at posting the inspections reports within 5 days of completing that process. And we kind of hover around the 5 days, and that would be reasonable. It's how you define when an inspection is over.
So you have a timeline on when you have to get the report back to the facility so they can start their plan of correction. And then they have 10 days after they receive your report or your citations to get you the plan of correction back. So what is the timeline between, how soon do you have to get the report back to the facility?
Well, we try to get it back within 10 days, 10 working days.
So that's 20 days right there. You get that back to them in 10 days and they have 10 days to respond to you, right?
Yeah, we have 10 working days to get it out to them. They have 10 calendar days to get it back to us. So yeah, roughly 20 days. And there's oftentimes when we don't get it to them within the 10 days because, as I just explained, and if it's something that's very extensive and they ask for an extension to write their plan of correction, we have often provided some extension to them to do that. There are also times where even if they do provide us their plan of correction within the 10 days, we have to go through a process of reviewing it to see whether it's acceptable or not. And often we will tell the facility, this plan of correction is not acceptable. Try again. So they've got to do it until we can accept it. So and we ask for them to be very clear on who's going to be responsible for what activity, and how is the citation going to be something that will be preventable in the future, and not just how you're going to fix the problem that we identified.
I think the original problem, Keith, was that the reports weren't being posted or weren't being made available at all. Wasn't that one of the problems? Not how soon you posted it, but they just weren't being posted.
Yeah, folks weren't able to find the reports at all for very lengthy periods of time, much longer than the 20 days you're speaking of.
Well, prior to the several years ago, the statute being changed to require us to post, there was no requirement to post. So if you're talking about that period of time, yeah, we didn't post anything because we weren't required to. So, and then once the law came into the statute, and we were posting, then the concern was like, well, you're not posting within the 5 days because you're not posting way out here instead of within 5 days of exiting the facility. We went to court, as I explained. So
So Keith, I think what I heard, and members, correct me if I'm wrong, the issue was, we want you to do a comprehensive and intensive assessment and giving opportunities for correction because we need all these facilities. But I think the question was, if I'm looking for a facility and I look at the website, there's no information on any of the facilities. If there is a way on the posting that's clear for anyone looking for a nursing home or ARCH or whatever, that I know that these are ones that pass muster and these are under inspection and these have corrective action, at least to post where it is so that the public knows that it's under inspection, not that they have the report at that time, but the report is forthcoming. And then when the report comes, then you link to the report. But at least there's a running gauge, I think, of what's available. And I think that was what I heard in past meetings. And people correct me if I'm wrong, if there's, other information you want, but not that you cut short a good assessment of the facility, but have some information on what is available to put my mom or dad or whatever. So you can respond to that on what kind of information that the public would like to know about what are facilities that are available, that pass muster upon your inspection.
Senator, I'm sorry, are you asking other members to weigh in
No,
on what
well,
they'd like
no,
to
if
see?
other members can join in, but I think if you can respond to that, I know that was one of the problems raised in the past, that they wouldn't know what is good and what isn't. And if it's under inspection, it's good to know it's under inspection. And maybe even a frontage page of these are the facilities that have been inspected, they passed muster such and such date, and then not necessarily the report, but if they're under inspection, you just say it's under inspection, and it leaves it open until such time the final report with all the corrective actions and so forth then gets linked to that. But at least the public knows, these have passed muster. Can you do something like that? Because I think that was one of the issues.
Well, that's what the inspection report is. The inspection report is to say who we conducted an inspection on, what findings we had, what corrective action is required of the facility, and so that's what we are posting.
But I mean, the question is, you said that some staff come back and say, there's nothing rises to a finding or need for corrective action. These are okay, they're fine. At least knowing what those are,
right,
would be helpful.
But that results in an inspection. If we go into a facility and we don't find any deficiencies, no citations, that's the report, and we post that.
Okay, and that could be posted within 5 days of coming back.
Yeah, those are
those are reports as well.
Yeah. So those are all reports. So
okay.
So they get an A+, by not having any deficiencies. Anytime we go in to do an inspection for license renewal or recertification, whether it's on an annual basis, and typically they're annually, we result in a report, even if there weren't any citations.
Okay. Okay, so others, so if in fact it's okay, then that's a report and that would be posted in 5 days. So if you did it, you came back from an exit interview, you spoke with staff, and that was an okay facility, in 5 days from when you decided that there's no findings that rise to the level of needing corrective action, that would be posted.
Yes, so there's nothing to write, and there's nothing for the facility to submit, and so the report is no citations. Those are easy, and we have some of those, not a whole lot. So yeah.
Unfortunately.
Unfortunately. Yeah.
So are there any other questions, members? I'm hearing that we don't want a curtailed inspection. On the other hand, we would like to have information on those that muster in your reports, your inspections. But are there
just like the consumers, just would like the consumers to be able to look something up and see if they've been flagged and what they're looking at. That's a huge decision they're making when they're moving somebody into a home. And so even if you've been flagged and you're making corrective actions, it would be great if that was at least posted, and then what the corrective actions were. I mean, I don't know what you do now as far as the report, but what I'm hearing is people are having a very hard time finding reports at all.
So I looked at the website, and it is kind of hard to navigate it because you do put every inspection is just sort of a running list, and some have reports and some don't. And I know that you're understaffed. I mean, we should help you get more staff with 22 staff and the thousands that you have to look inspect with the intensity that you do. But is there a way to get someone to help you to post on your website to make it more user-friendly, as Rick is saying, that you would list the facility and at least for 2021, these have been inspected and it's under review, and then just leave those that you have finalized a report, then you can link to the report. Is there something like that where people can just see off the top, just running through what facilities are inspected and are okay? I think that's what people are asking for is, are they okay?
So we have a search function on our inspection website. We also have an ability to sort. So if you go into our website, and I just sent the link to everyone in the chat,
He sent
if
it.
you'd like to look
Okay.
at that. So if you're
People
looking
look
for,
at that.
if you're
Look
looking
at that
for,
link that's in your chat.
so if you're looking for a specific facility, you can type in the name in the search box, or if you're looking for a certain type of facility, there are columns on this page. It's got the name of the facility type, the inspection reports for the years 2018, 2019, 2020, 2021. But next to the column heading facility type, you can sort. You can sort in ascending or descending order, and then you can identify.
That's good.
Thank you for sharing that.
Okay,
You
so
can
here it
identify.
is, folks. So how do you press on this thing? So you would look.
So you see,
You have to search.
move your cursor to facility type, and you see
Uh-huh.
those up and down arrows just to the
Mhm.
right-hand side, no, to the right-hand side of facility type. Yeah, press that.
Ah,
Okay, and now if you wanted to look at all the adult daycare centers, those are grouped all together. Because otherwise the default sorting is by facility name in alphabetical order. But if you just wanted to see adult daycare centers, that's how you would do that.
so
And you can go to each page, you keep on going, and all the types of facilities would be grouped together: adult day health, adult day care, adult day health, assisted living, and you keep scrolling, and you'll see them all together. One of the improvements that we're in the process of making to the page is that if you only wanted to see skilled nursing facilities,
it's skilled
we're
nursing.
going to create a search function just for that. We're also going to create a function where when you find the facility, you can. We're trying to link it to a geo mapping where you can see where the facility is located.
Done talking.
Or if you wanted to search within, X miles of your home, and find just those facilities that are proximal to where you live or where your loved one lives, or proximal to whatever, you'd be able to do that. So those are the other kinds of enhancements that we're currently in the process of creating.
So Keith, we're going to open up one of these reports. Can you just hit on this 2018 one? So this is, tell us what this is. So this is a deficiency report, and it shows where there's corrective action or not. So like this one doesn't, it seems like everything passed muster pretty quickly.
Correct. Yeah, this is an adult daycare. This is St. Francis Adult Daycare Center in Diamond Head, and it's got the address of the facility there. This is one of the facility types that are inspected by our contractor, Community Ties of America, who does the inspections of the adult daycare centers, the community care foster family homes, and those are the kinds of reports that are posted here. So,
okay, so question, Keith, go back to the back to this. So on this page, go down to. So if it were possible, and I don't know who your website person is, but if they're possible, instead of people having to open up each of these, that you would have some indication by color or, you know, a little check mark, pass muster, and so that people know they want to look at a glance which ones of these are okay to send my mom or dad. And they've got, instead of opening each report, is there a way of making it more user friendly in that regard, so we know that there's an inspection that was done and this facility is okay, you know, without having to read all the reports, just some indication of a check mark, you know, efficiency has been corrected or whatever, so that they know, okay, I know I can see at a glance all of the ones that have check marks I can go to.
So I think that's a bit of an oversimplification. I think it's important for people to see what the problems are that we've identified and that they've been fixed. We do not issue a license to someone who doesn't deserve it. They've got to submit their plan of correction. We have to accept that plan of correction for them to be issued a new license. So once we accept their plan of correction, you know, that's what's posted. So one of the things we have started to do is that if we end up sending the inspection report to the facility for them to do submit a plan of correction, we're posting that inspection report even prior to getting that plan of correction back. And then we repost it once we get that plan of correction back. So we're trying to be as timely as possible in providing information to the public by at least saying, here are the deficiencies we found. Now,
But I guess
I don't think that's particularly useful to the public to not see that they've had the opportunity to make those corrections. But that's what we were.
Hit the ARDC.
That's what we were instructed to do.
Just again, Keith, I know you guys are doing a good job, but if I was the public and I'm not in the weeds on what you do in terms of deficiency, I just know, I want to know, okay, if you have deficiencies, what are they? Are they severe or not? But this one's no deficiency, right?
Right.
If I were the public, go back to the front page. If I were the public, not really into all your comprehensive inspection, you know, but I want to know, go back to the front page. I want to know what are the facilities in my area that have completed the inspection, they have met the corrective action. I just want to know that. I don't want to read through all the reports. So if you hit the facility type, there. Okay.
Senator Moriwaki.
Yes.
I'm so
So
sorry.
Yeah, just a question, real quick question. So if you had all these ADCs and then there was a way that if they met the corrective actions, then there'll just be a little check or something next to it, so then I know all the checks that I can proceed and read the reports to see what was corrected. But at least I don't have to read through each report on my own as you know, somebody looking for a place to put my mom. So that's the question I think that came from the public that I understood, and making it easier to go through the website and find facilities that we could, you know, place my parent in. So I don't know. So I'm sorry, I cut somebody off. So whoever was asking a question, please feel free to now proceed.
And can I go after Pokii? I'll let her go.
Okay. Okay, Pookie.
Oh, she's muted.
You want to unmute if you're on mute?
Sorry, it was me, Senator. I didn't mean
okay.
to interrupt you.
No, fine.
Apologies for that. I just wanted to clarify from my understanding what you were asking, because I know, so are you like talking about like we're just gonna look on there and it's like a red, doesn't have to be red, yellow, green, but like red means, you know, somebody's facility isn't that good, or green? Because I'm just wondering, Keith, do you guys even have, you know, something like a general template to use to score facilities like that. And because I've have to go through survey every year. I think on Keith's end, and correct me if I'm wrong, it's a little hard to develop that because there's so many different deficiencies that can be given out. And so, and there are various levels too of the deficiencies. So I don't know, for me, I kind of feel like it's important that the people read to see what the facilities got cited for, because some might just be administrative, some might be sanitation and nursing care. So if they don't know that, then and a facility is read, but it was not anything to do with nursing care, then it could be interpreted as there's not a place to go, but the citations might have had nothing to do with nursing care. So I'm just, wondering if there is the keys, if you guys even have a template that can use for this, but I mean, I think that's a huge endeavor, but.
Yeah. Keith, can you answer, Keith?
Sure, I'll be happy to, and thanks for sharing some of your experience as well, being on the inspection end of the business. And I've worked at hospitals as well, and so I've been on the inspection end of things as well. So I totally understand. So for someone to be licensed, they have to fully comply with the licensing requirements. For them to get a license renewed, they have to fully comply with the licensing requirements. It's a pass-fail. You don't meet the requirements, you don't get a license. So we don't have a system where we can say some are green, some are yellow, some are purple, they've got different levels of deficiencies. We wouldn't allow that. We wouldn't allow them to continue to have the deficiencies that might warrant them a D. You have to pass. Now, we don't wait, as Poki was saying, we don't weight the surveys by, is it a quality of care issue? Or is it a dietary issue? Or is it a building issue? Or is it what? It's you have to meet everything. That's the requirement. And so, and let me, maybe this will surprise some of you, but the licensing requirements are minimum standards. They have to at least meet that. That's the minimum. So by having a grading system and a color scheme system, if that's what somebody is considering, says that it's okay to be deficient in some areas. Really? Would we want? Would the state government want to be telling the community, the public, yeah, these C-level, D-level facilities, okay, yeah, they're fine to put your loved one in. Would you? No, I don't think so. I wouldn't. And so Puki is exactly right. If you want to be fully informed, you got to look at the report. And I think it's a valid question to ask whether there's an ability to create a shortcut version, but this is a pass fail. You have to meet everything.
Caroline and then Kathy.
Sorry, Kathy. And what I wanted to add too is I think it would, if there was a ranking, which I totally agree with Poki and Keith, is that, we should read the reports, is that that's why they have to make that informed decision whether they want to put their loved one in there based on whatever they read in the report. I think it would almost be a liability to the state if we were to suggest or do some kind of scaling or something of it, because then they may come back and say, well, you said it was okay. You know what I mean? So I think we have to take that into consideration too.
Thank you, Caroline. Kathy?
Yeah, I was going to say that if I was doing due diligence to find a proper home for my family member or whatever, the facilities, after they get their reports, they have to have those in a public area for anybody that walks in the door to see. So if I was going to do due diligence to find a nice place, I would visit the place. I wouldn't worry about a report online. I'd visit the place and ask to see that book. And Even though,
Okay.
Keith, I've been on the director of nursing and administrative end, so I didn't like you guys very much, but I I understand. But I mean, there's all sorts of ways. You don't have to wait a report to be posted. It's there. As soon as they do their plan of correction, it's there to be seen. So just my 2 cents worth.
Kathy, I appreciate those comments because you're exactly right. Exactly right. The visual of reading a report is different from visual of going there and looking and seeing for yourself and smelling. Are there smells that you shouldn't be smelling? Even if it's bleach, even if it's cleaning agents, you shouldn't be smelling cleaning agents. Right? What are you trying to cover, or what are you trying to hide? And so that and listening also. When you go to the facility, listen. Are call bells going off and not being answered by the staff? These are all very important things that and are serious things, and that hopefully the public are doing before putting their loved one in a care home.
So are there any other questions? I think Keith has done a really good job in informing us about his work. I think with the thousands that he has to look at annually, I think we have to support him in getting more staff. In terms of looking at all of these facilities, how do you manage going through? I don't know. I counted 480, 1,700, 2,100, let's say, with the hospitals and everything. How many are there that you have to inspect a year, and how is that done with your 22 staff?
Not very easily, and sometimes we're late. On the Medicare inspections of skilled nursing facilities, they give us a window of time. There isn't a hard date of December 31st. The Medicare certification ends, and if it's not renewed, the facility has to close or what have you. They give us a window of time to conduct these inspections. The state licensing, we have specific times. You're licensed from January 1 to December 31st. We've got to go in and we've got to do that inspection and complete the inspection before December 31st so we can reissue the license. So we can even look to see whether we've got some flexibility on the state side as well. But it still has to get done. And that's the important thing that we get them done.
And so
any system can be improved. Any system can be improved. And so I do appreciate all of your comments and all of your concerns, because that's what we want to do. We want to try to improve and then improve upon the improvements. So I do appreciate the opportunity to be here. And I certainly look forward to your continued manao and providing some input on how we can improve.
So we appreciate that, Keith, and you really have quite a job, and we appreciate your thorough inspection, because that's what we want as well. It's not just a really quick and dirty inspection, and we've got problems out there that people don't know about. So thank you. I don't know, are there any other questions or comments from anybody? Okay. Well, I think you've explained why you can't do the reports after you exit a facility. So we understand that. And if there's any way that the Kupuna Caucus can help in terms of anything, whether it's staffing or it's other policies that will help you do your job better, please let us know.
Sure will.
All right. Well, thank you very much, Keith.
Thank you so much. Take care, everyone. Have a good long weekend. Aloha.
Oh, you too. Aloha. Okay. So, moving along, unless you have any comments on the facility inspections and reporting, I think we will have to accept that unless we want to go push for more staff for him to do it faster and put the reports up faster, we might have to encourage more support for him. Any comments, anyone? Okay, I'm going to now turn over to Caroline we don't have much time, but Caroline, you want to talk about the Kupuna Recognition Day that we found?
To my great surprise, after being at the Executive Office on Aging since 2000 and 2006, there was put into law through the Hawaii Revised Statutes a Kupuna Recognition Day, which is the fourth Saturday of July. Am I correct? Fourth Saturday.
Correct.
I'm sorry, I don't have it right in front of me.
Yep, correct.
And it's really to honor those that perpetuate. And I'm not sure if we could, maybe Charles could put the actual, I don't know if you guys have it.
Yeah, it's coming up. It's coming up.
Oh, great. Okay, thanks. It's to share the honor or recognize those that have made contributions to culture, Hawaiian culture.
Hold on.
Okay, thanks. Oh, there it is.
It's
Hawaii's
right there.
culture, history, and traditions. And we know that that's about 4 weeks away. So we were trying, Senator had reached out and said, you know, what could we do in the short time frame that we have to do something, especially this year in 2021, as we're coming out of COVID. So my thoughts were, and I do apologize, I haven't even spoken to Kathy about this, but would be just to do possibly a star advertiser ad in the paper honoring those that we had recognized at Older Americans Month. Those that were recognized, I mean, those that were awarded, and also those that had been nominated. So that's what I thought,
Oh,
even though it doesn't really match up with recognizing culture, history, and traditions, and we can plan for that for next year. But Senator, and correct me if I'm wrong, is we really wanted to do something small, but at least something to acknowledge our volunteers in the community. And we thought about possibly doing those that had been already recognized during Older Americans Month.
I think
I guess we just wanted
at least start the recognition going, that we start to follow the law.
Yeah.
But I think that, you know, being that we're looking at this late date, and with COVID, we really were planning something pre-COVID. But I think if you share some ideas that you might have, not extensive or not really pulling a lot of people together, but doing it. I know that Caroline had mentioned something in the paper that we could recognize volunteers, or any of your ideas of how we could do that this year, and then work on it. Kathy, I see Kathy. Yes, Kathy.
Me again. Caroline, isn't that what we used to do once a year down at the Capitol, that we'd had exhibitors all over the place with goodies for the Kupuna, and everybody came down, and there was food and there was dancing and all that stuff. Wasn't that Kupuna Recognition Day?
No, that usually, when did they do that? Kupuna Power Day. I want to say that was in October.
Kupuna Power, that's what that was. Never mind.
Or was it in
Power? I can't remember what it was. I just know
I
we had
remember when it was, but yeah, it was. I know it wasn't July.
No, but that was Kupuna Power. That wasn't Kupuna Recognition, right? I'm sorry, I forgot.
Yeah. No, but I think if, you know, we had time, that July could be something like that, although it is on a Saturday of the first Saturday of the month. So, you know, but something like that could be more extensively done maybe next year if we had time. And so this year, at least recognizing the day and recognizing our Kupuna might be something little less ambitious that we could think about. And that's
Or maybe if it's not, I just thought of something, Senator, when you were speaking, is to maybe that's an educational piece, what this day is about, what it was, the intention was. And then we could put in something about the number of volunteers throughout this, older adult volunteers throughout the state, and just some kind of summary of things that they do. I mean, that would be another way of possibly.
So would you have funds in EOA to do that, to have like maybe a full page ad, or I don't know what you do, and you know, on a Sunday or the Saturday paper saying today is
There's
recognition.
no more Saturday paper, yeah. So
Oh yeah, no, a Friday, either a Friday paper, is like tomorrow is Kupuna
It
recognition.
would have to be Friday. It'd be kind of
Yeah.
weird if it was Sunday, right?
Yeah, no, Friday, and then we could say tomorrow is, and then the volunteers, and then some services for the for the kupuna that all the counties have maybe, and list some of those, so that you educate as well as recognize maybe. I don't know. Okay, so does that make sense? Do we want to have the, like a group that help Caroline? Because so that we should be a thing where, you know, we could put,
It's gonna be a quick
or EOA, or
turnaround.
PAPIA, maybe PAPIA.
Well, see, we have a recognitions and awards committee. Kathy, I'm so sorry. I'm
Oh.
throwing this out. at you
I
just right
I
now.
leave it up to you folks to decide.
Well, let me ask you a question, then. Horace.
Kathy,
Do you guys celebrate the elder, what is it called? I'm sorry, Kupuna Recognition Day on Big Island?
No, we're kind of just like hearing about it.
what about Maui? Maui? No?
Or Hawaii?
Sorry.
Hawaii?
So MEO kind of always heads this up for us in Maui. They have every year an annual recognition day, and we participate in that. So last year and this year it's virtual.
Okay, so maybe we could do a one-page thing if you've got some money, EOA, for like publicizing the
We could,
awardees or.
that wouldn't be difficult to, it's not like. it's-
Yeah, and then maybe get the county offices, the AAAs to put in what their services are, and then maybe the people who had the awards for this year, the older recognition awards. And if there's any kind of Native Hawaiian elderly group or something like that, so that we cover the cultural. If you could get that, could maybe have the AAAs help you put that together, so we have representation from all the counties. And then maybe Pabia might be a co-sponsor of the thing too. The Pabia and all the AAA advisory council could be like co-sponsors. I mean, but you pay for it.
Carolyn, should we have a discussion Monday or Tuesday?
Tuesday would be fine, yeah.
Okay, I'll leave it up to you folks, but I think it's a good idea to start recognizing our elderly. And that would,
Senator, would you like us to send you back a draft of something to you and Representative Hashimoto to take?
Yeah.
a look
yeah, sounds good. And we would support it if you need some help from us. We will be more than happy to help in terms of support. Funding too, maybe individually, I guess, from our funds, but you need help on that. And then any staff support can help.
Okay.
I leave it up to you, Caroline, to work with everybody who can help put that as a statewide recognition of.
I think if we keep it simple enough and maybe use it as kind of that launching pad to educate about the day, and then just the next time we can plan accordingly. I feel so silly though. I mean,
but don't say we just learned about it.
No. That stays here.
The long-standing. Okay, so that's wonderful. Are there any announcements from anybody? During our bewitching hour. And I do have one announcement, as we were following up on bills, so Representative Hashimoto and I met to look at what bills were left on the table. We were successful, and we want to mention that although not in the Kupuna Caucus package, as you know, it was, curtailed down to 5. The Alzheimer's training bill passed. So we were happy about that as well. And then what was the other one? Alzheimer's stuff. The third. There was a third bill. What was the other elderly bill? It was another bill. Now it's left me.
The Alzheimer's coordinator bill, did that change?
The coordinator, but no, there was another bill. Sorry, it slipped my mind.
Crimes against seniors, the one we
The
you
crimes
told us,
against seniors, that one got signed,
yeah,
but
yesterday, yeah.
bills that weren't in our Kupuna package that were also senior bills. And I'm sorry, it slipped my mind. But there were two other bills. The Alzheimer's coordinator was in your budget, but the Alzheimer's training program for first responders that passed.
Mhm.
So there are some bills that were good that passed, and we need to still look at. I'm talking to Rick, and we were discussing the choices bill, yeah, and bifurcating. But the other. So next time, we've asked Colin Hayashida, who's the insurance commissioner, to talk about the other bill that didn't pass, which was the giving notice before lapsing long-term care insurance, and what his take and why he opposed it. So we will look at that. And this is the bill. And then we'll do the same thing as we did with Keith today, find out what the reasons were. And there's also impacts of the insurance on the elderly going forward. So we can also ask him those kinds of questions. So that's for the July meeting. Any questions? Oh, I mean, sorry, August meeting. I'm not really not sync today. So, are there any other announcements?
Well,
Rick?
I would just like to thank Senator and the rep for joining the Good, Bad, and the Ugly. And again, I would just recommend folks take a look at that. That's on the Kupuna Council Facebook page. I'm not going to post it here because we're going to sign off, but it's there and you can watch it. It's long. We went over, but you know what? It was remarkable. The discussion, I thought, maybe you, Senator and Rep, if you're on there, could chime in. But I thought it was a very good discussion and well worth watching and listening to. So, and I thank you for all the help with everything. Appreciate it.
Thank you, Kupuna Caucus, for sponsoring it. It was very good. Thank you. Okay, so have a very good, happy 4th of July, and thank you everybody for staying on, and appreciate all your